So this is the case with bilateral femur fractures. So speaking to that person where you don't necessarily have a normal, and so depending on which fracture you're going to use different, which fracture you have, you're going to use different clues. Dr. Will pointed out to the panelists that the linea aspera is also a great reduction tool, and I totally agree that using that as a guide to your reduction, because it's a palpable, visible structure, especially with some of these open patterns with soft tissue stripping. So here, just like we saw earlier case, we've got a supracondylar, intercondylar. So doing an open reduction, provisional fixation. I've got my merchant view here showing I'm not stenosing the notch. I like that when I've got an unstable distal fragment. And then here it's just clamp city, right? I'm trying to balance the stabilization to get everything to line up. And then I made goalposts going in front and behind. So you can see that I've gone one lateral to medial screw anterior, one lateral to medial screw posterior. I'm still within the cortical boundaries of the, diaphysis, or metaphysis of the femur. So none of that is going to be into the knee joint, but that's going to create a little bit of a goalpost. So that's going to maintain my compression in my intercondylar split. And then starting with my start point in the appropriate spot, and there's a little rotation here. And I think to Harmeet's point, I probably start a little bit lateral here. And so that's going to set me up for some malreduction, which you're going to see. But I like my sagittal plane reduction, and then working down through the, sorry, just going to get rid of the drawings here. Working down, getting my distal stabilization. At this time, I was still using this implant, which has a spiral blade as well as an interlocking screw, and then the blade gets locked with a set screw from the end. And here you can see that instead of, here's her other side where I had a nice mid-shaft fracture where the coronal alignment was done for me, and her alignment is 83 degrees for her ALDFA. And then on the side that I fixed that was more distal, you can see that the medial cortex just doesn't quite come along the nail where it should. And I've got about 5 degrees of extra valgus on this person. So sort of close, but no cigar, but I think a lot of techniques that I liked. She elected not to have any sort of correction done here, but I think this shows just sort of really watching carefully to make sure we can get everything as close as possible.